Hey there! Today I'm diving into how the General Authority for Healthcare Accreditation and Regulation, or GAHAR, ensures quality healthcare in Egypt. If you're a healthcare professional, you'll want to stick around for this one. Alright, let's talk about how GAHAR sets national standards to ensure high-quality, patient-centered care. One key aspect they emphasize is the involvement of patients and their families in healthcare decision-making. Let's break it down. First up, we have structured communication protocols. GAHAR mandates that hospitals implement protocols to ensure regular and effective communication. This includes scheduled multidisciplinary team, or MDT meetings, where patients and their families can interact with all relevant medical staff. These meetings happen at key points, like admission, treatment planning, and discharge. Now let's talk about clinical rounds. These are conducted daily, sometimes twice daily, and families are encouraged to be present. They can ask questions and participate in discussions about the patient's care. For more complex cases, GAHAR mandates family conferences to discuss treatment options and long-term plans comprehensively. Next, we have open communication channels. Hospitals must provide 24/7 access to healthcare teams. This can be in person or through designated communication channels like telehealth services. Hospitals are also encouraged to use technology, such as patient portals, to give families real-time access to medical records and updates. Moving on to involvement in decision-making. Shared decision-making is a big deal for GAHAR. The multidisciplinary team approach brings together nurses, doctors, dietitians, and pharmacists to discuss treatment options with the family. Before any major procedure, hospitals must organize consent and information sessions to explain the risks, benefits, and alternatives. GAHAR promotes the Patient and Family-Centered Care, or PFCC model. This model encourages a collaborative partnership between healthcare providers, patients, and families. Hospitals must assign a designated liaison to keep families informed and involve them in care routines. Patient and family education is another key aspect. Nurses lead education sessions to explain medications, procedures, and self-care techniques. Before discharge, a multidisciplinary team meets with the family to discuss post-discharge care. Feedback mechanisms are crucial too. GAHAR requires hospitals to implement systems for patients and families to provide feedback. This includes surveys and patient and family advisory councils to improve communication and overall patient experience. Cultural and individual sensitivity is a must. Healthcare teams are trained to adapt their communication based on cultural backgrounds and individual needs. Translators or cultural mediators may be provided if needed. Finally, continuous training of healthcare teams is essential. Regular training ensures that nurses and medical staff are updated on best practices for patient and family engagement. This includes simulations of family meetings to handle complex cases effectively. In conclusion, GAHAR's standards ensure that healthcare institutions facilitate regular and structured opportunities for patients and families to meet with healthcare teams. This holistic approach enhances communication, shared decision-making, and overall care outcomes. Through scheduled meetings, transparent communication, educational support, and patient-centered policies, GAHAR ensures comprehensive and inclusive care. Thanks for watching. If you found this video helpful, don't forget to like and subscribe. Stay healthy and informed.